Hello everyone, a very good evening. Homeopathic Medical Association of Telangana welcomes each and every one of you all to Sri Nyapati Venkata Srinivasa Memorial Oration. Now, first of all, I call upon our President Sir Dr. Gopalakrishna Garu onto the dais. I welcome our General Secretary Dr. G. Durga Prasad Rao sir onto the dais. Now, I request the dignitaries on the dais to please pay tributes to Dr. Shri N.V.S. Srinivas Rao sir. We request everyone to join while paying the tributes. Thank you, everyone. Now, I request our President Sir to please give the welcome address and introduction about today's memorial oration.
Good evening, ladies and gentlemen. A very heartful welcome to all the participants of the Zoom session and the live session. And our General Secretary, Dr. Durga Prasad Rao, Dr. Gautam, Dr. Sai Shruti, Chamundeshwari, and all the other participants of this session. And our distinguished speaker, Dr. Pradeep Kumar Gupta. We extend a heartful welcome to you, Speaker Sir. So we are eagerly waiting to hear you for your valuable address for this session. So today's session is sponsored by Dr. Nyapati Venkata Srinivasa Rao's family. Dr. Nyapati Venkata Srinivasa Rao Memorial Oration was instituted maybe more than a decade ago by the family members of Sri Srinivasa Rao. He was the founder of Ramakrishna Homeo Stores, which was initially established in Tenali of Andhra Pradesh state, and later it got shifted to Vijayawada and then to Hyderabad. So Sri Srinivasa Rao was a diploma holder in homeopathy. He learned homeopathy and he established the retail outlet at Tenali first, later shifted to Vijayawada and then to Hyderabad. And he also started manufacturing of homeopathic medicines So his only mission was to see quality homeo medicine is available to the needy people at an affordable price. So that was his mission. So with a great dedication and devotion and love for homeopathy, he started this activity and he has been running it. And later his family, his two sons, Sri Krishna Rao Garu and Sri Ramarao Garu took over. And later his grandsons, Dr. Srinivasa Rao, Vasu and other took over. So on this occasion, we pay our heartful homage to Nyapati Venkata Srinivasa Rao Garu, and we also extend our heartful thanks to the family for sponsoring the oration. And I once again welcome Dr. Pradeep Kumar Gupta, today's honorable speaker, for accepting our invitation to deliberate on homeopathic approach in the treatment of cancer. Thank you, one and all. I extend a very warm welcome to you all. Thank you.
Thank you so much, sir, for acknowledging the audience about today's oration. Now I call upon our General Secretary, Dr. Durga Prasad Rao Garu, to tell us about HMAT.
Respected President Dr. Gopal Krishna sir and other governing council members and dear viewers, on behalf of Homeopathic Medical Association of Telangana, I am privileged to pay heartfelt gratitude to Sri N.V. Srinivasa Rao, on whose memory we are conducting this program today. And you know all about the HMAT, the various activities running over for the last 55 years, like Dr. C.L. Modi Charitable Homeopathic Dispensary and different specialty clinics on various days by committed and senior homeopathic physicians of the Twin Cities. And we thank them all for their generous contribution in running the charitable clinic and specialty clinics. And also we conduct memorial orations every month on the last Sunday of the month on somebody's name in memory of some important persons, celebrity person. And we are also thankful for all the sponsors for their generous contribution in holding the monthly orations regularly. And we also conduct periodical national, state level homeopathic seminars now and then. And we train the house physicians posted by the different homeopathic medical colleges, all the private colleges, including government college, for so many years, and to hone their skills in improving their clinical acumen in treating the patients. And besides this, we are also coming with the online journal, Medicina Futura Homeopathica, under the able guidance and stewardship of our chief editor and honorary advisor of HMAT, Dr. Shivashankar Kunapareddy sir. And like this, we conduct many programs and bring awareness to the people of this society and in learning about the homeopathy as well as the efficacy of the homeopathy. And at last, I thank all the family members of the Ramakrishna Pharmaceuticals and Ramakrishna Homeo Stores, Sudha Madam, Naveen Garu, and Vasudeva Rao Garu for their generous contribution and supporting us in conducting this N.V. Srinivasa Rao Memorial Oration continuously. Lastly, I thank one and all you for viewing this program. Thank you.
Thank you so much, sir, for sharing your valuable words. Now I call upon Dr. Gautam sir to introduce the speaker of today's oration to the audience.
Good evening, one and all. On behalf of Homeopathic Medical Association of Telangana, I, Dr. Gautam Ralabandi, invite you all for today's oration, both offline and online. To introduce about the speaker, Professor Dr. Pradeep Kumar Gupta, Principal, Founder, and Chairman at Nyapati Homeopathic Medical College Hospital and Research Center, Agra. Sir has completed his DHMS in the year 1984. Later, he joined as a medical officer under government of Uttar Pradesh in the year 1985. He took VRS as Deputy Director Homeopathy, Uttar Pradesh in 2010. Selected in State Civil Services UP in the 1988, but he did not join as he found no profession is better than homeopathy. He started IPD department in District Hospital, Agra during his tenure as District Homeopathic Officer in Agra. The first homeopathic doctor in the world to reach the milestone of receiving 3 doctorates of medicine in the homeopathic subjects, namely Repertory, Materia Medica, and Organon of Medicine. He established Nyapati Homeopathic Hospital OPD and IPD in the year 2007. Later established Nyapati Homeopathic Medical College in the year 2010. Established Nyapati Ayurvedic Medical College in the year 2018. Nyapati Homeopathic Hospital became the first NABH accredited homeopathic hospital in India in the year 2017. Sir has over 40 years of practical and research experience in the fields of so-called incurable diseases like diabetes mellitus, cancer, rheumatic arthritis, ankylosing spondylosis, many other autoimmune disorders, etc. He has experience of treating all kind of medical emergencies in the IPD very effectively by homeopathy. It's the first homeopath all over the world to register a clinical trial with ICMR CTRI to research the effect of homeopathic treatment in the management of COVID-19. Recognized and acknowledged worldwide for his invaluable contribution to the society during the tough COVID times, and he treated over 12,565 patients with only 6 mortality without using any PPE kit and mask. Nyapati Homeopathic Hospital has also become the first homeopathic hospital in India to start a 200-bedded quarantine center during COVID-19. Subsequently, it was upgraded by government of UP as 150-bedded COVID care hospital. It is the first homeopathic hospital dispensing LM potencies and centesimal potencies only in water as guided by our master Dr. Hahnemann in the 6th edition. His mission, Har Ghar Homeopathy, is the main mission for which he started clinical training program in Nyapati Hospital and also conducts workshops to empower homeopathy across the globe. Some of his achievements, International Hahnemann Zentrum Torg at Germany, Healthcare Excellence Award 2024 by BW Business World Channel, Best Teacher for Outstanding Dedication by North American Medical College of Homeopathy, Canada, Saptarishi Samman 2022 by Natya Academy, UP, Seva Shiromani Samman by Sukhamani Seva Sabha, Agra, Award of Best Health Care Provider by Central Jail, Agra, Uttar Pradesh Government, Agra Hero Award by Sri Kshetra Bajaja Committee. Doctors from all over the globe from various countries come to Nyapati to learn IPD and emergency management of patients with homeopathy. Professor Dr. Pradeep Kumar Gupta takes care each and every patient spiritually, physically, mentally, financially as his own family members. We welcome you, sir. It's a pleasure for our association to have you here. Thank you.
Thank you so much, sir, for acknowledging the great, excellent achievements of the speaker for today's oration. Now we welcome the speaker of this oration to please take over the session.
Good evening to everyone. Good evening, everybody. Am I audible?
Yes, sir.
Okay.
Yes, sir.
First of all, I thanks to Telangana Homeopathy Medical Association for inviting me such a prestigious event, and I am thankful to all who are associated with this event. And lastly, I am very thankful to the audiences who loves me so much to listen my views on cancer. So I would like to start the session with the some cases, thereafter my insight how to deal with the cancer. The presentation is visible on screen.
Yes, sir.
Okay. This is a case of carcinoma of prostate, and this is a wonderful document that homeopathy is how much effective. That's why I am presenting this case to this August gathering. Apart from the carcinoma prostate, the man is also having diabetes last 20 years, hypothyroidism last 12 years, hypertension last 10 years, and vitiligo last 6 years. This is the registration number, and he is a 63-year-old male residing in Agra. The presenting complaint was involuntary urine since 2 months and unable to hold the urination. His prostate specific antigen was 3000 when he came to me for the treatment. Also complaining the diabetes as well as the ulcers in the mouth last 3 months, and these ulcer aggravated when he takes the food. Hypertension and hypothyroidism, for which he is taking the 100 micromilligram tablet every day. So these were the presenting complaints. The mental stress, his son got divorced as the daughter-in-law filed a case for torture and dowry. This causes insulted feeling in the society as well as the anxiety for future of the son, also the anxiety for money loss. Because in this their dowry case, he has to pay a lot of money. This was a report showing the prostate specific antigen is 3000. And this report was done on 30th November and case came to me in month of December. This was my prescription to the case. Sulfur 6C, 1 globule mixed in 100 ml water, 5 ml solution to be taken after 2 strokes, 1 hourly. And they follow up after a month. So after a month, this is the video of follow up. Just listen what the gentleman is
बताओ
saying.
भैया क्या क्या ठीक है आप?
इस समय शुगर सही है मेरी।
शुगर सही है?
हाँ, छाले सही है मेरे।
छाले सही हैं
और सूजन सारी खत्म हो चुकी मेरी।
सूजन सारी खत्म हो गई?
हाँ।
अच्छा।
बाथरूम जो डिस्चार्ज जिस तरीके से हो रहा था,
हाँ,
वो अब बहुत काबू में आता जा रहा है।
बहुत काबू में आ
पहले।
गया। अच्छा। और जो आपको PSA,
हाँ,
प्रोस्टेट स्पेसिफिक
हाँ, वो
एंटीजन
इस बार
कितना था पहले?
3000 था, अब
हाँ।
154 आया, 154।
154। कितने दिन में इतना आराम आ गया आपको?
1 महीने करीब।
1 महीने में PSA 3000 से 154 आ गया।
जी।
ठीक है। और डायबिटीज बिल्कुल ठीक है?
डायबिटीज नॉर्मल चल रही है।
और
टेस्ट
सूजन
करता
होता
हूँ।
है?
जो 3 टैबलेट लेता था मैं,
जी।
1 टैबलेट लेता हूँ।
ठीक।
तो इसलिए कि मतलब ज़्यादा अप डाउन नहीं हो जाए।
वो भी छूट जाएगी अगर आप पूरा परहेज करेंगे तो।
जी।
ठीक है? ठीक।
So the patient is saying that the urine flow improving gradually day by day. And now the PSA is 154 only in 1 month, and it came down so heavily from 3000 to 154. Now there is no swelling on the body, and the blood sugar is also became normal. Initially he was taking 3 tablets for blood sugar, now he is taking only 1. And the ulceration is mouth is also better. So this is a testimony that a correct constitutional remedy can cure the whole personality within a short time. We all know that diabetes is not curable, but I say since long that diabetes is very easily curable by the constitutional remedies and some changes in the diet and regimen. So here the treatment was as per patient was aimed to prostatic carcinoma, but my aim was here to treat patient holistically. I never treat in the parts and by the specifics. So this kind of result is possible by the deep understanding of the personalities. You look this face. He is a very prominent businessman of this city. Also his son. So this was the clue to prescribe the sulfur. So after a month, I prescribe him sulfur 9C. The same method, 1 globule in 100 ml water and 5 ml of that water to be taken after 2 strokes and repetition 2 hourly. And this is the PSA value 154 just in a month. This report is 1st January 2022 and the last report was 30th November. So only in the month of December, the PSA came down from 3000 to 154. Look the change in the personality. Last video I have seen the face of the patient. Here see the face of the patient. Just enjoy what they are saying.
भैया मुझे ये बताइए कि ये जो मेडिसिन खा रहे हैं
जी।
कितने दिन हो गए खाते हुए?
मेरे को हो गए 2 महीने।
2 महीने। 2 महीने पहले आपका PSA कितना था?
3000।
3000। प्रोस्टेट स्पेसिफिक एंटीजन 3000 था। और अभी कितना है?
29।
29।
जी।
कब कराई ये रिपोर्ट ये?
3 तारीख को।
3 तारीख को। और यहाँ पर आप आए थे 20/12 को।
जी जी।
तो 20/12 मतलब लगभग 1.5 महीने में,
बिल्कुल बिल्कुल। हाँ।
1.5 महीने में 3000 से प्रोस्टेट एंटीजन
29।
29 आ गया। चलिए जो लोग कहते हैं कि होम्योपैथी बहुत स्लो काम करती है, आप उनको क्या कहना चाहेंगे?
अनबिलीवेबल है सर,
अनबिलीवेबल। अच्छा,
अच्छा, एलोपैथिक के डॉक्टर्स को भी यकीन नहीं है कि ये 29 आ गया। 29 है, वो भी सब चौंक रहे थे।
चौंक रहे हैं।
सब
So on this is a follow-up on 8th February. After 2 months, the PSA is 3000. And this is now 29. It is unbelievable to the patient and to the attendant and to everyone. But not to me, because I see this kind of cases every day. So in the second follow-up, I just increase the potency from 9C to 12C, and the same one globule mixed in 100 water, 2 strokes, and repetition is 3 hourly now. And this is the report taken on 3rd February. Last report was 1st January. So after 34 days, from 154, it becomes 29.6. Now look the changes on the face. Listen what he is saying.
मतलब 2 हो गया, ठीक है। शुरू में कितना था? 3000। 3000 से 1.99 मतलब 2।
ये है सर, सारी रिपोर्ट से सारी पीएसए की अब तक की इतनी
अपना 3000 से पीएसए जो है वो 2 पे आ गया। नॉर्मल, कुछ चिंता की बात नहीं है। और डायबिटीज भी ठीक ही हो गई। अब आप
थायराइड भी ठीक है सर।
थायराइड भी ठीक है, सभी कुछ ठीक है। डायबिटीज की, थायराइड की कोई दवाई खाना मत, ठीक है ना। और
बीपी मेरा कंट्रोल में है।
बीपी भी ठीक है। कुछ कोई अब एलोपैथी दवाई आप खाओ ही मत, ठीक है ना। कोई परेशानी हो आगे मुझे बताओ।
So the PSA is only 2 now, and the diabetes is absolutely normal. The blood pressure is also normal. Stop all the allopathic medicines. Hypothyroidism also normal. Appetite normal. Urine flow good. Everything all right within 3 months. The prescription was 15C and 4 hourly. This is the TSS, normal. Creatinine little bit high. And this is the 4th follow-up.
आपकी बात को नोट कर लेता हूँ, कर लो। भैया बताइए कैसे हो?
ठीक हूँ इस वक्त, बिल्कुल
बिल्कुल ठीक हो?
हाँ।
क्या क्या ठीक है?
थायराइड सही है,
This is the body
शुगर
language
सही
of
है,
the patient now.
थायराइड सही है और बीपी भी सही है, शुगर भी सही है,
प्रोस्टेट कैंसर था वो भी सही है,
प्रोस्टेट कैंसर भी सही है।
जी हाँ।
अब आप मुझे ऐसी बात बताओ कि दुनिया कहती है कि कैंसर ठीक नहीं हो सकता, आप कह रहे हो प्रोस्टेट कैंसर ठीक है आपका?
मेरा तो सही है साहब।
आपका सही है?
बिल्कुल, दवाई रेगुलर ले रहा हूँ
जी,
और दवाई ले रहे तो बिल्कुल सही है। और एलोपैथिक दवाइयाँ मेरी सारी बंद है।
सारी बंद है, कोई एलोपैथी दवाई नहीं ले रहे?
कोई एलोपैथिक दवाई नहीं।
अब देखिए आपने 4 समस्याएं बताई, प्रोस्टेट कैंसर,
जी हाँ।
किसी को बताओ भैया मानेगा कैंसर ठीक हो जाएगा?
हम तो अपने रिश्तेदारों में, अपने मिलने वालों में
सबको
सबको
तारीफ कर रहे हैं इस बात की।
अच्छा,
मतलब हमें विश्वास जाने की चीज वो नहीं थी कि उनकी पिछले साल 15-20 साल पुरानी डायबिटीज की गोलियां बंद हो जाएंगी। 4 टैबलेट खाते थे दिन में,
डायबिटीज भी ठीक हो गई, बिल्कुल ठीक है 100%। थायराइड भी ठीक हो गया,
थायराइड,
ब्लड प्रेशर भी,
ब्लड प्रेशर सारी गोलियां
सब बंद है और सारी दवाई बंद है अंग्रेजी,
सारी
टोटल एलोपैथी मेडिसिन थी।
So in the 4th follow-up, he is saying that he is completely fine. the prostate complaints are all thyroid, blood pressure, blood sugar, everything is normal. Urine normal, sleep good, and not taking any allopathic medicine. He is completely fine. So this prescription was sulfur 18C, 6 hourly, 5 ml solution. And this is the report of glucose fasting 124 here, diabetes all right. And the PSA is 1.99. So within few months, 7 months, from 3000, it became 1.9. So this is the power of correct prescription, correct dosing, correct repetition. So homeopathy means minimum dose. So this is the example of minimum dose. One single globule of number 10 mixed in 100 ml water, divided in 20 doses. And the minimum potency started with the 6C, and now the treatment, the disease is finished by the 18C. So this is a message who start with the 1M, 10M, 2000, etc. Reconsider their strategy and the dry doses. As Henneman has said in aphorism 272, that the dry doses touches few nerves. And he said that dry doses are the biggest dose. So my suggestion through this webinar to everyone, those who are listening, what Henneman has said in more than 200 years ago, in aphorism 272, please come out and follow that. In this, my office, one of the guests from Telangana, Dr. Ramadevi is here. So later on she will speak what I am doing here, her experience. Now I will present one more case and thereafter my understanding on cancer. So the first case I shown the pure case where the no allopathic indulgement for cancer was done. And here is a post-operative case. So this selection of this case too for the idea that there are so many patients, they comes to you for post-operative, post-chemotherapy, post-radiotherapy. Don't try to treat them. If it is coming directly, even then don't try. As you've seen that the sulfurs 6C, 9C, 12C, finally 18C cured prostatic cancer. Here is the case after post-operation, the patient was not willing to take the chemotherapy. So he was here. Here a high-grade metastatic serous carcinoma of right ovary with thyroid dysfunction, hypertension and diabetes. And these all associated complaint were all right by the constitutional remedy. So this is the patient, this is the first interaction. She is just after the operation here in the OPD.
बताइए।
छाती में थोड़ा सा यहाँ पे दर्द होता है, छाती में दर्द होता है और पेट में यहाँ पे।
और
पेट में क्या होता है बताइए? अभी थोड़ा थोड़ा यहाँ पे दर्द है, यहाँ दर्द है। और ऑपरेशन कब हुआ आपका? 28 तारीख को, मार्च को। 28 मार्च को। क्या चीज का हुआ? कैंसर का क्या, कौन से पार्ट में था कैंसर? अच्छा, यहाँ दर्द। क्या निकाला? यूट्रस, ओवरी? बस एक गलत। At the moment, she is complaining for pain in chest, pain in abdomen, radiating to back and to the whole spine. She is feeling severely weakness, exhaustion, difficulty in walking, standing, sitting, and she is not able to sit even 4-5 minutes, and also to talk. Pain in abdomen, became restless but cannot do anything. As you seen in the video, she was wearing this belt to support the back. In the past history, typhoid in a fracture, cholecystectomy and hysterectomy. She has already gone with the 2 operations and 1 major injury. She is married 20 years ago, 1 male and 2 female children. Allergic bronchitis resulting breathing distress started in the 2nd gestation. She is vegetarian by diet. Physical generals which I found in the case, the appetite intolerable, and when she is hungry, feel too much weak. Thirst is not marked as vomiting after taking water in much quantity. Bad taste and the dryness after radio and chemotherapy. Desire for salt, extra salt, mango, curd. Intolerance to smoke, strong smell, fragrance. Perspiration, forehead, sleep on abdomen. Mental generals, I found him loquacious. She had a very strange thing, good emotional bonding with her mother-in-law. Very rare in North India. But a conflict with the sister-in-law and the brother-in-law. Her brother-in-law and sister-in-law interference too much and try to quarrel with the truffles. She feels very sad and lonely as husband and the mother-in-law not supporting her over this fight. She loves to company, so craves to company and sympathy. This is the report from the JP Hospital, Noida. Histopathology. Look here. Suggesting a diagnosis of high-grade serous carcinoma ovary. So concluding, histological grade, high grade. Other tissue organ involvement, yes. Appendix, omentum, small intestinal nodules are also involved. Largest extrapelvic peritoneal fossas. These are the metastasis everywhere. Lastly, microscopic peritoneal metastasis beyond the pelvis. So this was my prescription to see the lady. Pulsatilla, the nickname is windflower, LM1. 1 globule, mix in 100 ml of water, and the 5 ml as I took as a quantity from that, and the SOP is 4 doses initially at every 5-minute interval, thereafter 1 hourly. She got admitted in the hospital, and by the same day in the evening, look the face. Look here in the afternoon, and here after the pulsatilla, 4 doses, the same day in the evening. Listen what she is saying, and she is not wearing belt now.
ठीक है अभी क्या ठीक है अभी थोड़ा पेट में भी ठीक है पेट में भी ठीक है सब ठीक है
So the correct constitutional remedy gives relief within few minutes. Look the happiness.
ठीक है अभी
Look the body language. What she say? Yes, I am very happy. So she saying feeling much better, weakness reduced, stamina better, pain on abdomen reduced, now able to sit without belt. Such a serious, difficult, pathological patients can get relief within an hour by homeopathic remedies if chosen correctly and prescribed correctly in the water doses. So now the prescription was 1 hourly. Next day morning, listen what she is saying.
पेट में दर्द है अब मैं थोड़ी जल लेती हूँ तब थोड़ा ठीक हुआ
पेट में दर्द ठीक है
हाँ जी
ठीक
ऊपर हो जाता ना
अब जैसे आपको 24 घंटे हो गए यहाँ पे 24 घंटे के हिसाब से आप कितनी ठीक लग रही हैं फर्क है कितना 1 रुपए में कितना
1 रुपए में 60 होगा
60 पैसे फर्क है ठीक थैंक यू
The patient is feeling overall betterment 60% in 24 hours. Pain abdomen and backache. And overall, she is saying she is 60% better in 24 hours. Windflower LM2 1 hourly. Look the face. 3rd day.
ठीक है कुल मिला के पहले से कितनी ठीक है ठीक है कल आप बता रही थी 60% ठीक है तो आज कुछ बड़ी है या उतनी है थोड़ा ताकत आ रही है ठीक हो जाएंगी
बस पेट का दर्द नहीं आ रहा और एक में कौन वो डॉक्टर ने गैस की दवा दे रखी थी पेंटो
हाँ पेंटो जी
और मैंने जब से आई मैंने वो बंद
लेना मत ये दवाई मैं दे रहा हूँ उसी से ठीक हो जाओगे ठीक है खाना वाना खा रही हो पेट साफ हो रहा है ऐसा जो मन में डर बैठा दिया कैंसर 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 तो अब कैसी हो ये बताओ
अभी तो ठीक लग
डर कुछ निकला
जी ये ठीक हो जाएगा ये मेरे को
आप बताओ आपको लग रहा है कि नहीं
हाँ वैसे तो ठीक लग रहा है
ठीक है बहुत अच्छे डरना नहीं है
नहीं मैं डरती तो नहीं
अरे वाह गुड
Feeling much better, stamina improved, flatulence is there but reduced than before, pain abdomen slightly present, appetite improved, stool satisfactory. During conversation, as you have listened, she was saying that she have antacid every day in the morning, and now she is not taking. I say don't take any allopathic medication. Don't worry, nothing to worry at all. So this is windflower to LM2 1 hourly was going on. And this is day 4. I found she is better and discharged.
और क्या क्या आप महसूस कर रहे हैं वो बताओ पहले से ठीक है क्या ठीक है पहले से
मतलब थोड़ा सा आराम है पहले से।
आराम है पहले से, आराम है।
बस ये तो तकलीफ भी पेट में है, बस थोड़ा भाई पैर में रहता है कुछ ये बहुत ध्यान दर्द होता है, मतलब जैसे ऑपरेशन के बाद मतलब वैसे पता नहीं क्या होता है, फिर मैं चुप हो जाता हूँ।
दिन में आपकी मम्मी 4 दिन में कुछ ठीक हुई है?
4 दिन में तो मुझे और कि जैसे पहले घर में गया था 2 दिन से चक्कर आ रहे थे।
घर में 2 दिन से चक्कर आ रहे थे, हाँ।
अब वो उठते साथ चक्कर
नहीं आ रहे, पर अभी वीकनेस है, हाँ, ठीक।
Patient saying, I'm good, feeling better. Pain abdomen reduced. Doctor said, my mother is much better than before. She is having no vertigo. Weakness persisting but very reduced. So the pulsatilla LM2 was given 1 hourly as it is. And this is the first follow-up.
पहले से क्या ठीक है?
पैर में भी आराम है, पहले से जो दर्द होता था।
हाँ।
अब ये हाथ काम नहीं कर रहा।
पेट का क्या हाल है?
पेट नीचे यहाँ पे दर्द है।
नीचे दर्द है, अच्छा। पहले के मुकाबले कितना है?
पहले से ठीक है।
क्या कह रही है ये, आप बताइए भैया। आपका मरीज पहले से ठीक है? नहीं?
हाँ जी, हाँ जी, हाँ जी।
ठीक है
जी,
संतुष्ट है इलाज से?
बिल्कुल बिल्कुल
ठीक।
Patient is satisfied, so the attendant, and I am also satisfied. So wind flower LM2 now reduced from 1 hourly to 3 hourly. Thank you very much. Patient is still under my treatment and she is much better. Now here I will show what I considered cancer. My opinion. Homeopathic approach towards cancer. I have seen that every homeopath reluctant to treat the cancer. So this is the importance that not to be hesitate to take the cases of cancers. Until unless you don't have a thought that you can cure the cancer, till then you will not take the cases comfortably. So listen here what I have understand. This is my campus and this is my hospital. The origin of word cancer. The origin of word cancer credited to Hippocrates, the father of medicine, 360 BC. Hippocrates used 2 words, carcinos and carcinoma. Carcinos for non-ulcer forming tumors and carcinoma for ulcers forming tumor. The Celsius, Roman physician, during the 50th AD, almost 400, 500 years after, translated the Greek term carcinoma into word cancer. So first the Hippocrates who gave the carcinoma word, and now the Celsius gave this word cancer. We are very happy that this word cancer is coming from 22 years ago.
Huh?
And
22 years?
2200 years ago, not 22.
Ah.
Sorry. And the Celsius was the person who gave this name. And here the Galen, almost 2000 years ago, gave this word oncos, on which the oncology is now going. This to describe the tumors. In India, cancer is mentioned in the Atharvaveda. And you know the Atharvaveda is much prior to all these Hippocrates and the Celsius and this Galen. The Atharvavada's time roughly estimated 2500 years ago from here. So roughly 5000 years ago. They have used two words, Arbuda, this is for malignant tumor, and Granthi for the benign or minor neoplasm. These two words we found in the Vedic literature. The oldest evidence of cancer. The oldest credible evidence of cancer found in the fossils of dinosaurs from prehistoric terms. So the cancer is existing 30,000 or 40,000 years. It's not new to all the living organism. Even the plants have cancer. So cancer is a genetic disorder, mainly in the defect of the 4 genes. Basically, the oncogenes, the gene responsible for the development growth of the cells. So growth of the cells is a natural process in the body. If the growth of the cells will not taken place, the person will die. So this oncogene, when produces more cells, more than required, they terms in cancer. And simultaneously, there another gene also present in every cell. Each and every cell nucleus contains this gene that is called the tumor suppressor gene. So when the oncogene produce more cells, this tumor suppressor gene suppress the growth of the new cells. So if the oncogenes cell genes is producing more cells, forget to produce how much, also the tumor suppressor gene also not functioning well, then this becomes a lot of production of the cells in the organs, which causes the chaos. Then the lymphatic system, the macrophage comes into the limelight. The macrophages acts like a police or the army, they kills these cells. But if the production through the oncogenes is more than the macrophages, then this process wouldn't be checked by the macrophages or by the CD4 count cells or CD8 cells or CD12 cells, which is responsible for the immunity. So this is a complex process when 4 or 5 genes are at default. First the oncogenes to the tumor suppressor genes and the macrophages and the CD4, CD12, CD8 cells, and lastly the apoptosis genes. We all have a programming in by the optic genes that the every cell has its time period, that like the RBC dies in 14 days, WBC dies in 7 days. If this apoptosis genes has also failed, so it is a complex process like this. So the cancer going to be produced in the body. And now we all know that homeopathic medicines are capable to repair the genes. So the treatment start with the repairment of the genes, not from the cutting of the cells or cutting of the organs or giving the radiotherapy or chemotherapy. It is their job, let them done. But we homeopaths can repair the genes by our homeopathic constitutional treatment. So we are the upper hand to treat the cancer as a whole. The first human evidence of cancer is found in the mummy in Egypt, that is 3000 BC. So this is the first evidence that humans are suffering from cancer more than 5000 years. This also mentions the Egyptian manuscript, Egyptian papyrus. Like we have the our Athar Veda, which have said this very particularly for the tumors. Arbod and Granthi. Homeopathy, the real hope for cancer, as I mentioned, that the homeopathy medicines has power to repair the genes. So if we are capable to repair the genes through our constitutional treatment, cancer is absolutely curable and very easily curable, which I have seen through my 2 cases. The Hippocrates has said the natural forces within us are the true healer of the diseases. So what is this natural force? In the context of Hahnemann's homeopathy, that is a vital force, and in the 6th edition, it is mentioned as the vital principle. And in the modern terminology, it is known as the immunology, immunity. So this immunity, which I have taken through the genes, is the true healer of the diseases. So the chemotherapy, the radiotherapy, the operation are not the true healer. Your medicine, the homeopathic medicine, which can produce the changes in the genes through the repairment of the genes, is the true healer through this process. This is said by Hippocrates, father of medicine. What Paracelsus has said, no illness is that grave that would not have its cure in medicine. So I believe on Hippocrates and Paracelsus, and there I believe on Boninghausen. Though every homeopath knows the Boninghausen, through his repertory, through the contribution a lot to the homeopathy. He also not written the therapeutic pocket book. He also mentioned so many articles, and in this one article that is mentioned in the lesser writing, what he has said is experience here. In malignant uterine cancer, only in the beginning, by means of the accurately discerned, not local, but general symptom complex. Mind the word. Not to give importance to the local symptoms, but to the general symptom complex, means the generality, along with sufficient concomitant or side symptoms. And what we do the mistakes, we focus on the local symptoms. We take the pain, local modalities, etc. We never go for the general symptom complex or the concomitant, upon which the, after all, final choice depend. What is final choice? The choice of the final remedy. Can a fortunate and complete cure be prognosticated, and most urgent necessity to choose with the greatest conscientiousness and care. So this greatest conscientiousness and care emerges throughout the fundamental knowledge of materia medica, not from the rubrics. And he has mentioned some remedies most fitting from the following recommended remedies. What remedies he has recommended for cancer? Arsenicum, aurum, belladonna. We barely believe that belladonna can cure cancer because we considered that belladonna is the acute remedy, a short-acting remedy. And since many years, I am saying to everyone that belladonna is not an acute remedy. I use belladonna in a very serious condition and I have cured very chronic cases. Belladonna, my first cured diabetic case by belladonna. So I have a firm belief that no medicine is acute. All the medicines are, if given to the constitution, can cure whatever the disease. Even there is known as uncurable. So here I once thankful to the Boningasan that Hahnemann has put the belladonna in acute remedies, but not the Boningasan. So I give the full credit here to Boningasan for my prescriptions for belladonna. Carbonimelis, China, Clematis, Kirozot, Lachesis, Magnesium ure, Mercurius, Platina, Pulsatilla, Sabina, Sarsaparilla, Sicalcor, Sepia, and Thuja. These are the medicines mentioned by the Boningasan. But I say these are not the only medicines. In my opinion, all the medicines from aconite to Ginkgo metallicum can cure all kind of diseases, including cancer. This is the experience of Boningasan, particularly in the uterine cancer. He has mentioned where this is the Boningasan burden, where with my colleague, he and his friend and myself have always succeeded in averting the threatened danger before it had reached to an incurable stage. So Boningasan 200 years ago was able with his friend to cure early cases of cancer of uterus. This is a testimony by the Boningasan. And we homeopaths does not believe in our science when this case comes to the cancer. No, this cancer is not curable. We need operation, we need radiotherapy and chemotherapy. This is, look, whatever is written by our. And my observation, my opinion on the Boningasan, in malignant cancer, final choice, medicine should be depend on generalities and the concomitants, which I do. This is my observation. Now I will quote here Bogar. I follow too much to the Boningasan and Bogar in my practice. What Bogar has mentioned in his lesser writing, I have seen a few almost unbelievable cancer cures. Mind the word, what has Bogar has written? Unbelievable cancer cures. And Bogar is a practical man, he is not a theoretical man. He was a wonderful practitioner and prescriber. From internal use of our remedies, almost any remedy, this word, any remedy. Bogar by the follower of Boningasan. Boningasan has mentioned certain remedies, but here Bogar has said almost any remedy has occasionally cured. Such a vast experience, man. When it was in far solely prescribed upon some special or prominent indications. And what are those indications? Symptoms which correspondent to the life history of patient, not the disease symptom. He has said the life history. So for Bogar, the life history is most important to prescribe. Hence, corresponding accurately and entirely to the disease picture. This is Bogar understanding. And what he has said, unbelievable cancer cure and almost any remedy has occasionally cured. So there is no ambiguity. The cancer is curable if we prescribe medicine on the life history of the patient. Second case is based on the life history of the patient. My opinion on Boger observations, I made it very simple here, 6 points. Life history, number 1, number 2, causation, number 3, mental general, number 4, time modalities, number 5, posture, and number 6, PQRS. And last I say, the doctor can have a stronger impact on the patient than any drug. If a patient, I am very thankful to Paracelsus for this quote. If a patient comes to you and you yourself are not confident, your patient will never be cured, never be better. So your personality is more stronger than any drug. So be thoughtful that homeopathy and you, particularly all of you who are listening to me, are able to cure cancer. And the fundamentals on which your medicine will be selected, first according to the Bonington, generalities and concomitant, and according to the Boger, and to me, life history, causation, mental general, time modalities, posture. In both posture, patient sits, sleeps, talks, stands, most important, and PQRS. If there is any peculiar, uncommon, rare symptoms you find out. So this is my take for today. Thank you very much.
Some questions are there, sir.
So as I have seen some questions are there, so I am going to answer each and every question one by one.
Firstly, suggest some books.
There is the first question. If you have any question, please suggest any book for study. So any book, all books are very good. It is up to you which book you read. And for me, I will show you. This is my table. Boger synoptic key. Boric. And most of my lovely darling is Allen's note. My 90% prescription depend on Allen's note, rest on Boger, rest on Boric. These 3 books, which I always keep in my heart, in my mind. दूसरा question.
Base of prescription and constitution of patient.
I always take the constitution is the primary to the my prescription. So this is question number 2. Question number 3, totality of sulfur. As I have seen you, he was a very rich man and looking an ugly man, and the clothes were rags. And when you read the वो लगाओ ना slide,
लगा हुआ है, आपको नहीं दिखा।
तो मुझे देखना चाहिए. And you whenever you read the Allen's note sulfur, I just read that to make you comfortable. The problem is in reading. That's why, and understanding of the Mathematica, as I showed you, until unless you are master to Mathematica, you cannot cure the chronic disease. In this sulfur, page number 252, scrofulous psoric chronic diseases that result from suppressed mental emotions. So here is the life history. As to Boger, there is a divorce case by the daughter-in-law. And he was not able to say anything about this. He was named. He was named in the police FIR as a dowry seeker, which he never seek. He was named as a torture to the daughter-in-law, which he never done to her. So this kind of symptom, this kind of mental pressure cause this cancer. The question number 4. Why LM1 and why in 6C? Look, to my understanding, 6C is lower than LM1. LM1 is equal to 7C or greater than 7C. And the pathology, I have never seen 3000 PSA in any case. In my 42 years, I have cured more than 100 cases of prostate cancer. Prostate cancer is very easily to cure. So I have never seen the PSA 3000. I have seen PSA in cases 100, 200, maybe 300 or 400, never 3000. So such a big pathology. What to do? Golden rule, start with the minimum. So I start with the 6C. And my 6C is the water, 1 globule. And in case number 2, it was the already operated. Once chemotherapy and radiotherapy cycle has taken by the patient. So I started with the LM1. I have demonstrated the reasoning and totality of the selected drug already. Patient was improved under 01 by changing 02. It is my submission. Read aphorism 248 very carefully. You will find the answer. Yes, I always prescribe single remedy to cure. And very rarely when I feel that patient is not curable, then I can use 2 remedy. Which book for constitution? Every book has constitution symptom. For complication and metastasis, any group of remedies? No. This is also wrong thinking. Just go on basics. Why 2-stroke? Hahnemann has mentioned 8, 10, 12. He has mentioned for LM. This mentioned for LM. Read the chronic disease. You will find 2, 4. This is related. This is not related. So if there is other question, then I am ready to take that. Otherwise, I think it's okay. Time is 5:34 already, and I have a lot of patients waiting. Here is one of my friend, sister, Rama Devi here. He is here. She is here. She will explain what she is observing here. Yes, Rama, come on the screen. You come here. Relax.
Good afternoon, everyone. I am Dr. Rama Devi from Vanaspatipuram, Hyderabad. I came here for the treatment of my father, who is suffering from unstable angina. He is better now. Sir says everything is curable. So I brought him. My mother was treated by sir for diabetes. She is normal without allopathic medicine. Her HbA1c is 6 and FBS is 110. Thank you.
Thank you, Rama. So if any question, please tell me, otherwise I am signing off. Thank you to all organizers and to the all audience. Thank you very much. Question hai?
Thank you so much, sir, for sharing your information
Thank
and
you, sir.
knowledge
Thank
about
you so much,
cancer.
sir. Thank you, sir.
Mahesh, hello.
Thank you, sir. Thank you, sir.
Okay.
Thank you,
Okay.
sir.
Thank you.
Now I call upon our President, sir, Dr. Gopalakrishna
Hello,
Garu.
Vesna.
Thank you so much, sir.
Hello.
Here in the screen, the Dr. Vesna, she is from the Belgrade.
Thank you.
Do you want to say something?
Thank you very much for good describe.
Thank you, Vesna.
Your biggest inspirations, sir. Biggest inspirations you are for homeopathy. Every day we are learning from you, sir. Every day, sir. Just because of you only today we are able to treating our patients, sir. All fear has been gone, sir, now. From my bottom of heart, I'm telling you, sir. And all credit goes to you only, sir. You are the
Oh, it's
only
your
person
hard work.
for biggest information. Since last 23 years, I was in general practice and left out completely just because of your inspiration. And today, no parasite, allopathy medication at all, sir, in my clinic. Only and only homeopathic pills. Once I visited your Agra center, my all doubts are cleared. And I'm totally free from my tension, anxiety, fear. Any type of cases, I'll say yes. जो पैरासेल्स ने आपने बोला था फर्स्ट प्रेजेंटेशन ऑफ योर डॉक्टर्स इतना भर भर के कूद गया सर ना भी ना आता है नहीं पेशेंट के मुंह से आई कांट से नो एवरीथिंग इज पॉसिबल गुप्ता सर कैन ट्रीट योर ब्लेसिंग्स आर विद अस एंड वेयर वी स्टक अप योर सपोर्ट्स आर ऑलवेज देयर सर थैंक यू सो मच सर थैंक यू
Thank
सो
you,
मच सर
Mahesh. Thank you.
Thank you, sir. Now I call upon our President, Dr. Gopalakrishna Garu, to please come on to the dais for the acknowledgements.
Good evening, everybody. I profusely thank Professor Dr. Pradeep Kumar Gupta sir for a very knowledgeable and informative talk with so many details and his experiences, and along with the video recordings of the beneficiary patients. So all this helps a practitioner in learning and knowing for true. So we profusely thank him. So the case of carcinoma prostate and another case of carcinoma right ovary, he gave us utmost details and how we treated and what were the stages of improvement. And he also gave quotes from Boger, Boningazen, Hahnemann, and giving us many details how to choose a remedy, what is to be taken care of while choosing a remedy. So all these intricacies have been very helpful. It will be very useful for all the practitioners to attempt and try treating cancers. So as our sir said, many of us initially hesitate to take up a case of cancer, but with this information and knowledge, experience, I hope many of us would, with all enthusiasm, attempt to treat cases of carcinoma without any inhibition and see that the patients are benefited. We once again thank Dr. Pradeep Kumar Gupta sir for his knowledgeable presentation. Thank you, sir. And thank you, audience, for your patient participation. Thank you.
Thank you for summing up the session, sir. Now we welcome Dr. Harshita ma'am for vote of thanks.
Firstly, we would like to thank our sponsors, Sri Nyapati Venkata Srinivasa Garu family, for sponsoring today's oration. And we would like to thank our today's speaker, Professor Dr. Pradeep Kumar Gupta sir, for taking out time and enlightening us on the treatment of on cancer. And lastly, we would like to extend our thanks to all the participants, both offline and online.